So what do you do when you're sick and tired of nursing at the bedside? Keep watching this video and I'm going to show you ways to avoid and help you through nurse burnout. Welcome everyone to the Momma Nurse channel. I'm Vanessa and here we discuss all things nursing, motherhood, and lifestyle. Make sure you leave a like on this video. Don't forget to subscribe to the channel so that you don't miss out on any uploads. So what exactly is nurse burnout? So nurse burnout is a reduction in a nurse's energy that manifests in emotional exhaustion, lack of motivation, and feelings of frustration, and leads to a reduction in work efficiency. So what are the main causes of nurse burnout? The number of patients that you have is a direct correlation to your chances of having nurse burnout, hence the patient-nurse ratio. If you have more than 4 patients, you have a greater chance of running into nurse burnout. Your long shifts are another reason you can end up with nurse burnout. Remember all those times that people say, oh, you only work 3 days a week, you shouldn't be tired? Well, realistically, those 3 hours, 10 to 12 hour shifts increases your chances by 2.5 times of having nurse burnout compared to those who work 8 to 9 hours. So that's all of us who work in the hospital setting. For those of us who work in a high risk setting area, that increases our chances as well. ED nurses suffer from the most nurse burnout, followed by ICU nurses. Make sure you stay tuned until the end so that you can find out ways to avoid nurse burnout. Now, what is the impact of nurse burnout? Lower patient satisfaction ratings, and you know it's all about the surveys. Higher patient mortality. Patients have a 7% higher risk of mortality when they have a nurse who is burnt out. Patients have a higher risk of infection with a nurse with nurse burnout. These are according to Health Affairs American Journal of Respiratory Critical Care Medicine. Now let's get into the real reason why you're here. How can we avoid nurse burnout? There are many different ways that you can avoid nurse burnout, but these are 6 of my favorite, especially number 4. Disconnect. When you leave work, leave work. Take your nurse hat off and forget about your day. Sometimes it is ideal to go ahead and have a little venting session right after your shift to your spouse, your best friend, a work buddy, whoever. But after that, let it all go and get into yourself. Stay energized by getting enough rest and eating well. If you are feeling stressed, don't be afraid to talk to someone. A lot of insurance companies nowadays do offer counseling sessions free of cost, and there are many resources, apps, and toll-free numbers out there that can help you and give you a resource. That way you can talk about how you're feeling. There are also mindful apps out there. That way you can start and end your day on a brighter note. This one is my all-time favorite, Get a Mani-Pedi. I prefer pedicures because we wash our hands so much. I like to do my nails at home if I'm gonna do them. But a pedicure is a must. This is my me time. I get to unwind, enjoy the massage chair, and get pampered. Acknowledge those small wins. No matter how small it is, reward yourself, applaud yourself. Make sure you acknowledge your successes. Remember your why. Why did you become a nurse in the first place? Remember your why and let it continue to fuel your passion. What's your favorite way to avoid nurse burnout? Make sure you comment down below. That way, myself and our fellow nurses can try it out if we're experiencing burnout. Don't forget to leave a like on this video. Make sure you subscribe to the channel so you don't miss out on any uploads. And until next time, all love.